the ophthalmic surgical procedure worldwide. So wound leakage is not uncommon, and early detection is important so that the efforts are made to restore the corneal integrity, which can be implemented immediately. If it's not caught early, patients are at risk of developing the cascade of sequelae, which also includes endophthalmitis. Annual dislocation can occur within a few days or within a few months. The incidence of annual dislocation within the first week after the surgery is 0.2 to 2.8% as quoted in the literature. And repositioning of the posterior chamber IOL in the ciliary sulcus allows the dislocated IOL to be restored to a position closest to its original fit. The proficiency in cataract surgery is one of the main objectives of surgical training during an ophthalmology training. So this study aims to report the incidence of early surgery rates after manual SICS, and also it compares the rate between the trainees and experts. And to our best knowledge, this was the first study in literature which studied on the resurgery rates in manual SICS and compared it between the trainees and experts. It was a retrospective single-center study, and the subjects included were from the duration 2012 to 2022. The inclusion criteria, the resurgery which was done within 1 week from the day of primary surgery, and the manual SICs performed by trainees which needed resurgery were identified and compared with those done by the experts. And all the resurgeries were performed by the experts. With the help of electronic medical records at our center, we collected the data, which included the demographics and the best corrected visual acuity. The factors that studied were the type of resurgery which was performed. That was either in the form of wound resuturing, IOL repositioning, cortical wash, and AC wash were included, and the rate was compared between the trainees and experts. Statistical analysis was performed using the software Standard Ocean 14. Categorical data was described as proportions and continuous data as mean plus or minus standard error. The data was analyzed by frequency, percentage, chi-square test, and Z test, and P less than 0.05 was considered statistically significant. So, in coming to the results, out of the 19,515 eyes that underwent manual SICS, 369 eyes underwent a resurgery during the study period, which accounted for about 1.89% of the total surgeries. Out of this, 213 were males and 156 were females, and most of the cases were in the age group of 61 to 70 years, and 205 were from a rural background and 164 from an urban background. So out of this 369 eyes, 176 underwent a wound resuturing, 133 underwent an IOL repositioning, 36 had cortical wash, and 24 had an AC wash. So these are two pictures of our patients who underwent these surgeries. In this, where there is a shallow AC and significant corneal edema, which underwent a wound resuturing, and IOL repositioning in this case, and the dense cortical matter in the visual axis, which had to undergo cortical wash. In this patient underwent a cortical wash with IOL reposition. When we compare the rates of resurgery between the trainees and experts, we found that the wound resuturing were comparable. That was out of the 65 cases, this was between 2018 to 2022. And out of the 65 cases, 31 were done by trainees and 34 by the experts. Whereas IOL repositioning, about 63.1% were done by the trainees, and 73.9% were those done by the trainees, that was taken up for cortical matter aspiration. And 64.7% of all the AC washes taken up for resurgery was done by the trainees. So these are few of the literature that we looked into. And the most common indication for reoperation included retained nuclear fragmentation, intraocular lens dislocation, and incision leaks. The effect of surgeon experience upon outcomes may persist, as one of the study done by Menda et al. Suggests that the complication rates decreases over the first 300 to 3,000 cases in independent practice. Our data added to this, as early training cases were at a greater risk for reoperation, especially IOL repositioning, cortical wash, and AC wash. However, wound resuturing rates were comparable between the trainees and the experts. A study done by Chi et al. Suggested that almost 1/3 of the incisions leak. So this was comparable to our study where out of all the resurgeries, 47.6% were that of wound resuturing alone. And in our study, there were 36.04% of resurgeries were IOL positioning. That was 0.6% of the total manual SICS performed. It was consistent with the study done by Greenberg et al., where they found that 0.9% patients presented with IOL dislocation and needed a IOL repositioning. So what we did was we utilized the international ICO Oscar scoring to assess the trainees' performance and also in turn impact of a surgical training program. And to monitor and reduce the incidence of resurgeries, the post-operative assessment was performed by the consultants. The trainees do the surgeries under supervision of a well-experienced consultant until they are confident. So after this analysis of 10 years, what we did was we started a retrospective evaluation of surgical videos of each trainee and discussed the theoretical and practical approaches toward improvement in the surgical competence of theirs. To conclude, a careful pre-operative assessment, training under supervision and other measures can be taken to reduce the resurgery rates, and timely diagnosis and early treatment can give better outcomes and prevent devastating complications like endophthalmitis. The limitation of our study is that we did not include the pre-operative and intraoperative factors which led to the resurgery rates and also the difficulty levels of the surgery that we compared. Thank you.